So now it's time for the Primorsko-Goranska region in Croatia. So the Croatian hospital. So we will have the webinar on the 25th June from 11:30 to 12:12. So then we will explain in more detail the challenges and solutions. But now, please show us a quick overview, Theodora, from your challenge and solution.
Hello, everybody. Our first challenge is to facilitate communication between specialists and family doctors in remote areas. For the introduction, cardiovascular diseases are one of the prominent diseases in the Western world with high mortality and morbidity, and especially in patients with heart failure that are released from the hospital, there is a need for up-titration of the therapy that is very important for their health. So we can monitor them with sensors for their pulse, for their oxygen, for their for example, blood pressure, etc. But we must follow their laboratory exams. We must follow them in connection with family doctors. So together in one conference, we can give them therapy as it should be given, very quick and very up titrated, so the issue for this patient will be much better. And then that is less coming to the hospital and more easier for the patients and for the family doctors to be together and to solve the problem. So we asked bit for bytes, and then they gave us the solution. So please.
The solution will be, can you hear me?
Yes.
Yes.
Yeah.
The solution will be platform-based. We're gonna design some prototype based on of these requirements Theodora say. Then we're gonna make adjust solution because we are already doing lots of platforms and we have some platform to start and continue with. So we actually are looking for some testing stuff like functional testing, usability testing, performance testing, and security testing. So we can assure the quality of the product is good and the security is fine, because in this application will be sensitive data and we don't want to leak them and put on the market, and to give someone access who doesn't need to have. So we need actually testing and quality insurance to assure the quality of the product. So the platform will be the web, possibly, and the mobile platform, some kind of a mobile platform. But we didn't decide yet about this because we are actually designing the prototype, and after the prototype will be finished, we will know a little more details than we know now. So in short, long story short, I think I said everything. So if you have some questions, you can always ask me.
Thank you.
Thank you. So let's move to the next, Theodora. So now fall predict challenge.
Well, this is also our challenge, the second one, because the hospitalized patients with cardiovascular diseases, especially with heart failure, have many comorbidities, and we want to give them secure and functional independency during their hospital stay. So we always are worrying about their fall, to hurt themselves, and we want to give them security, as they will feel better if they know that someone is watching them or taking care of them digitally, because this digital way will be wearable sensor to track changes in posture and movement, specifically focusing on detecting loss of balance and fall during the hospital stay. So nurses and caregivers will receive a very quality alert and then react on these alerts to prevent their fall and hurting themselves. That is our idea, to give security to hospitalized patients with heart failure. They are usually old, and it will be good for them. So the solution is?
Yes, the solution is Fall Predict. We are Sparky Solution. We are R&D company, and our plan is to build everything from technological point of view, from wearable sensors, from the input to the AI model used for the recognition of faults and for fault detections, to the real-time alerts and notification that will be used by the medical staff as it's written here. So we will do also the project coordination, initial testing and evaluation with the workshops and training. From the follower SME, what we expect is more focus on data security and integration, any tests related to quality assurance that are of course needed in these cases, and to engage with stakeholders mostly on workshops and training session that will be done together with us and with the medical staff. So in short, that's it.